Today, I'm going to answer the clinical questions from my best friend by introducing four very simple clinical cases. First one is socket preservation procedure only with patient own blood, not using any other graft materials. Other three cases are very simple socket preservation technique using moldable auto-BT dentin powders. This is the first case to show you the simple socket preservation procedure, how to put dentin powder as loose as possible, and the bone quality formed in the socket. Left is extraction of the second molar. This is the granulation surrounded the entire root. Even after removal of the granulation, the bottom of the socket is soft and irregular due to the ongoing inflammatory destruction of bone. And then just transfer the moldable auto-BT dentin powder, molded it into the round shape and pack it loosely and switch it. Let's see the video, this case. After extraction of tooth on number 37, remove the granulation tissue attached to the periapical area of the bone. However, the remained inflammation in the bone will be in the whole socket. If you see the bone quality after removal of the granulation, it's very soft or irregular as inflammatory destruction is going on. Generally, we need 2 and 4 weeks to come out of the inflammation and to turn the positive remodeling process of alveolar bone. As you can see, this is the moldable dentin powder. Molded it into round shape and placed it into the sockets with very light finger pressure. By addition of second and third moldable auto-BT dentin powder, see the coagulation of dentin powder with patient own blood. This is very important one. It turns into sticky foam when mixed with patient blood, you can see. And when it comes to packing several type of graft materials in immediate socket preservation after extraction, what we need is a space to release the remaining inflammation and infiltration of vascular supply. This is just for augmentation for the vertical increase of the whole socket, so that make sure to loose packing of the material as well as soaking with the patient's own blood in the socket is very important. So the vertical augmentation after socket preservation is also very easy with the patient's own blood and the simple instrument like this, you can see. And sutured like this. With this technique, this is before extraction, there was a huge radiolucent area of alveolar bone destruction, and half a socket was filled with moldable auto-BT dentin powder after socket preservation, just before you've seen the video. Usually, most of the surgeons think of a lower part of the radiolucent area should have been filled with graft material. However, as I mentioned, case 2, where there is a remained inflammation in socket, with some radiolucent destruction of the bone, waiting for at least 2 or 4 weeks to get rid of the inflammation, or in case of immediate socket preservation after extraction, loose packing of graft material is highly recommended to give the time for turning from destructive to reconstructive granulations in the alveolar bone socket. Let's take a look at how the dentin powder induces bone formation by this type of loose packing technique. The picture in the left shows a irregular borderline, which is the evidence of ongoing destruction of the bone even after extractions. On the right, dentin powder was packed only on the upper one-third of the socket immediate after extraction. The dentin powder on the upper one-third of the socket went down to apex. That means mixed with the blood clots from the socket base at 6 weeks after graft. On the other hand, there was increased radioplasty from a socket base. Looks as open bone. We understand this phenomenon as the beginning of a remodeling process from a socket base wall wholly under the influence of blood clots organized in the socket. After 5 months, bone from the upper one-third, which was from dentin particles, and open bone from the base were mixed and fused each other, increased the whole radioplasty, filled the whole socket. In addition, the crestal area is not collapsed, even without any membrane. Let's see the bone qualities. We took core tissues by trap-in biopsy before placed the implant to see the bone qualities. Under macroscopic exam, the upper part of the dot line looks slightly rough and irregular, where dentin particles were put into, compared with dense and compact. Lower part were filled with patient with own blood. See the difference and remember the difference between the dentin particles and the blood supply. Histological evidence strongly support this observation. The upper part shows the bones being remodeled in harmony with the dentin particles, while the lower part shows the typical characteristics of the naturally healed open bone in socket. As a summary of this case 4, first, loose packing of dentin particles and blood clots are sufficient to form bone from both sides in socket. Otherwise, you have to wait until the inflammation comes out, at least 4 weeks or another. Now I'm going back to first slide to answer the question based on previous 4 case presentation. The demarcation line 6 months after socket preservation might be from improper blood supply from alveolar bone due to tight packing of hydroxyapatite materials, because the materials remove the space for turning the inflammatory granulations into reconstructive granulation. That the material fills the space where the inflammatory granulations should have turned into reconstructive granulation, ended up with hindering the positive balance of bone remodeling at the apex area. However, when it comes to dental implant, the demarcation line does not seem a cause of concern. Rather than the demarcation lines, the bone quality, which will contact with implant surface directly, will be more of significant. In general, hydroxyapatite material at the central core showed approximately 60 to 70% as white void areas in this histologic feature. Contact with this area does not seem to be ideal compared to contact with newly formed open bone colored in orange area, which is occupying approximately 20 to 30% area. Overall, let's get into conclusions from the question my friend asked. First, wait for at least 2 to 4 weeks before socket preservation is more preferable to get rid of remained inflammation. During these 4 weeks, buccal or lingual wall does not collapse. This is still in the safe period to keep dimensions of the buccal and lingual alveolar bone height. So, preferably wait for 4 weeks to get rid of the inflammation. Second, if socket preservation is performed immediately after extraction, loose packing of graft material is highly recommended for securing natural healing and interparticular space for vascular invasion. In other words, do not pack the materials deep into the socket base. By leaving some space will lead to sufficient blood supply. Third, when it comes to dental implant, the bone quality, which will contact with implant surface directly, might be more of significance, so that when choosing graft materials, in addition to osteoinductive and osteoconductive materials, more osteopromotive materials are strongly recommended. If you have any questions or comments, please leave a message and we'll prepare an answer and we'll upload it. Thank you for your kind attention. This has been Dr. Um.